Hello there. I think we are live. Just making sure. Okay, it looks like we are live. And thank you so much for joining me live here. My name is Julie Hirschberg. I'm the owner and founder of Reactive Therapy and Wellness here in the LA area. And I'm broadcasting via Zoom, which always is a little funky, but I did that so that I can share a little bit about a poster that we just got accepted for the FND Society. And this one specifically is a poster that our movement disorder fellow, Lincoln Beal, submitted with our team at Reactive Torrance on a case report of a young girl with functional neurologic disorder. So I want to go ahead and share my screen here and also get this bigger for you so you can see it. Mm, mm, mm. Here we go. Okay, so I think you should be able to see that. So this is a little sneak peek. It's not in its final state, and we're going to be presenting it, or Lincoln's going to be presenting it at the end of the month at the Functional Neurologic Disorder Society. So we'll share more after that date. The Functional Neurologic Disorder Society, by the way, excellent organization. They have a biennial meeting this year in Boston, and it's with providers from all over the world who specialize in functional neurologic disorders. Earlier this week, I went on our Instagram page to share about a poster that I submitted with our team of a case of somebody who had functional neurologic disorder post-concussion. And this case is one that's titled Outpatient Integrated Treatment Approach in a Patient with Complex FND, a case report. So this is a really lovely person that we all really love to work with. It was really a complex case. This is part of the reason why we submitted this, because people come to us with complex cases all the time asking, like, can this person really be helped? They have a feeding tube and they're blind and they're having seizures and headaches and weakness and sensory symptoms. And that's exactly what we found in this case as well. So many functional symptoms, and yes, an integrated treatment approach works to help somebody with even a multitude of symptoms. And honestly, this is not the only person that we work with. I know it says a complex FND, but I think most people that we see with FND have complexities and multiple symptoms, and that's really common. We have a process of simplifying that using our pie charts. You can kind of see that in the middle, where we put together a 10-week program. By the way, so this was a much longer program. Our integrated team of PT, OT, yoga therapy, and psychology. And what you can see is that really what we do is take what's complex and really distill down the sensory components, motor control, psychosocial, lifestyle, autonomic, and physical limitations. And most people have some component of all of those. And it's really about discovering together what's the biggest piece of the pie. And there was a really big, as you can see, sensory and motor control piece of the pie, as well as autonomic. Those were kind of the biggest pieces. And physical limitations, things like hypermobility that are contributing to symptoms. So we take what's complex and really distill it down to what is also pretty simple, and set up an approach, an integrated approach. So what I love about this is that you can kind of see a progression from not using arms or legs or even head and neck or swallowing or seeing, to starting to use arms, starting to use the body and trunk, being able to sit up, use both arms eventually, And actually, beyond the scope of the time of this poster, also be able to take out that feeding tube, which was really, really big. So Lincoln will be presenting this poster. He'll discuss the treatment approach that went into it, and also these great results where person really went from blepharospasm and functional blindness to being able to see, from not using limbs and the trunk to being able to use them, to needing maximum assistance for all mobility and movement, to being able to do some things on her own, to going from not having sensation to having sensation. So you can see that in the results section here. So I'm super proud of our team for coming together and working together through this case, and very proud that this is also part of our movement disorder fellowship. Is every year our fellow takes on a research project, and every year we've had really great contributions to the profession in many ways, and I'm so very thankful and so very proud. Chelsea Richardson's our fellowship director, and so she's really guided Lincoln, our fellow, along this process, but really he brought it together. And it's really truly a reflection of our team and the power of an integrated program for people. As you know, I'm going to go ahead and stop sharing this for a moment. I've been sharing about our integrated programs quite a bit. And that really is because this is becoming the heart and the focus of what we do here at Re+active. This is becoming more and more of our standard way of working with people, because the outcomes are so powerful when we get to work together as a holistic team. We see greater improvement in a quicker time for people. So this has been a really exciting time at Re+active to see this shift and to be able to do this together with our amazing team. So if you're not already on our newsletter, the videos that I share every week, links to resources. This week, I really want to link to the FND Society, because they've been really instrumental in my own knowledge and learning in functional neurologic disorders. And this is the conference, the meeting that we'll be going to this month, and sharing these posters. You can join our newsletter at reactivept.com. If you're a person with a neurologic disorder, we send things specifically to you, or reactiveeducation.com if you're a healthcare provider. So if you're a healthcare provider working with people with functional neurologic disorders, this is our passion, and we really want to share what we're doing to help you. And I literally got an email this week from a former student. It came late last night, just before I went to bed, and I read it. Actually, I'm just going to pull it up because it really brought tears to my eyes. So thank you, Michelle, for the email. She had been working with a 19-year-old for the past 6 months with FND, and has downloaded our resources and emailed me and asked me questions and things, and they had a real breakthrough. And what she shared, she said, they modified a task, and this person was able to move and walk. And she said, as she's doing this, I turned to her father, both of us with teary-eyed and jaw dropping, that something finally connected her brain to her body to walk again. It was such a big accomplishment for my patient to see that she could do this today. And she just said, I want to thank you for your guidance to help my patient find the key for her to unlock this part of her brain. That was really a beautiful way to say it. But by the way, so thank you, Michelle. Thanks for sending that great email. And that's so true. That's exactly what is possible in so many neurologic disorders, is that we can unlock capabilities for people. And so it's really such a pleasure of mine to mentor, to talk, to discuss with other healthcare providers how to help people do that. So I just wanted to share that with you. Join our newsletter if you're not already. We'll send out our free resources. We also have a brand new well, a newer bundle of FND resources that I just added to last week. I added our pie chart to our FND bundle. So if you don't already have that, you can grab it at reactiveeducation.com. It's all our resources to help you with your folks with functional neurologic disorders. So we've got our River Runneth Over handout. We've got our big picture pie chart. We have our assessment cheat sheet. We have our FND webinar. We have a ton of resources, and we put them all together in one spot and free for you, so that you also can be like Michelle and find some really great breakthrough with your patients. So thank you so much for being here, for joining with me today and every week to keep learning and growing together. And I really hope you have a fantastic weekend, and I'll see you next week.